So welcome to this session at the Reach Conference. I'm here with Suchi Kapoor and Pervez Yousaf from the organizing committee of the Teach to Reach Conference, and very pleased to be sharing on behalf of the Geneva Learning Foundation some of what we've learned. And we had to learn very quickly. So we've been doing digital events for years. I'm going to be sharing a little bit about my own background, but first of all, thank you for joining this session. So about my background, in many years ago, an Undersecretary General called me into his office and asked me if I could help him bring the organization I was working for at the time into the 21st century. And he said, I'll give you you have 100,000 Swiss francs, 4 people, and you have to figure out with that how to serve the needs of 13.1 million active community-based volunteers. So that's when I became interested in what does education look like at scale? What does it mean how do we solve organizational problems like these? But when we're dealing with hundreds, thousands, or potentially millions of people, of professionals, and we're talking about adult learning, so that's also a very specific context, and we're about organizational learning as well. So some of the questions that then I asked myself, and some of the realizations I had from engaging with some of the people that I found that helped me answer the questions, the learning theorists, the people who'd been practicing, exploring digital learning for decades by the time I met them. And one key thing that emerged is there's a fundamental transformation of the economy of effort. So that's really a question and a statement. What can we afford to do? And then what we can afford to do, which is going to be about new things. Before I go any further, for any of you who are trying to figure out, who can see the benefits and the value of digital transformation for learning, so moving learning into that digital space, there's one question that we shouldn't be spending any more time on, and that is, can you learn as well online as you can in a face-to-face context? So in 2010, these two studies, the two biggest meta-analyses performed, really tried to ask those questions and answered them fairly definitively. And surprisingly, for some, distance learning results in increasingly better learning outcomes than FTF or face-to-face. And that's been true since 1991, when the learning technologies were far more rudimentary than they are or should be by now. And then the other thing is, some people say, well, let's do the best of both worlds. We can do blended, and that means some face-to-face and then some things online. And so it turns out that in the studies that I've looked at, there's generally no clear benefit associated with blended learning. The only reason people get slightly better results is they actually spend more time learning, because they spend some time in the classroom and then they have to spend additional time online. So that may come as a surprise. It probably, it certainly was a surprise for me when I first, I thought blended learning was a great idea. It's kind of like gamification, one of those ideas that sounds really good, and then you realize, you want to think about it more carefully. So then came the Geneva Learning Foundation, and really our mission is to explore, to do research and development, to figure out new ways, better ways to learn and to harness that digital transformation and its potential. So we developed a theory of change, a lot of it grounded in the work we've been doing since 2016 on immunization, and trying to wrestle with these organizational problems, dilemmas, and so on. And here, I want to talk, at the time, the network was 15,000. It is now close to 30,000 and is still growing fast. 90 countries in this conference are 120 countries. We're now running cohorts of 400 people, but then you can see there are more than 6,000 people at this conference. There are more than 6,000 people in the COVID-19 peer hub. And when people think about digital learning, it's usually you think of yourself alone late at night in front of your computer, and that's not, that's not necessarily a lot of fun. What we found is, I'm going to tell you about the most amazing outcome, and it is an immunization, and it is some of the people in this room, which is the Impact Accelerator. I'd like to tell you that this is what digital learning actually looks like, and you can see all of these meetings in various countries You can see, and here you can begin to see the Impact Accelerator. These are all from July 2019. So obviously pre-COVID, with this affirmation that we are together. And why would these professionals, immunization professionals, be meeting on their own time? This was not a training. This was not their daily work. What were they doing? Why were they coming together like this? Why were they giving each other certificates and awards? Well, I would say that we figured out how to build this kind of human knowledge network, and we did that together. So it's not us at the Geneva Learning Foundation. Sure, we have the learning theory, the practice, but it was really figuring out how to connect that with people on the ground trying to make a change. And then, of course, it can be very nice to meet with peers and enjoy talking about your work and so on. Does it actually make a difference? So we actually showed in July 2019, so again, pre-COVID, that in a 6-month period, we could move the needle very quickly and accelerate the progress towards implementation of projects that actually started as courses as course projects, and then became something more than that. So then came, of course, the shock. All right, then came the shock of COVID, and we saw many organizations, individuals. Here, initially, our thinking was mostly looking at international organizations, but we also saw, obviously, we were busy running the Teach to Reach program. So we were obviously trying to figure out what we should do. We didn't have to stop anything because it was already fully digital, but we did have to think about how were we going to respond. And then, building on the Impact Accelerator work, we asked the network, we asked the Teach to Reach participants, and through a series of weekly meetings, we built up what became the COVID-19 Scholar Peer Hub. And again, this was all fully digital, fully remote by that point, under the constraints and the stress of the pandemic. But lots of people, when they think about what is digital learning, you do have this really scary vision. This is 19th century. This is Jean-Marc Coté in Isaac Asimov's Future Days, a 19th century vision of the year 2000. So this picture has been around. You can find it on Twitter, on LinkedIn. People repost it. It's kind of a nightmarish vision for what digital learning looks like. Is this what we want? Would we want to put all of WHO's guidelines, for example, into the heads of all immunization professionals? There's also this vision. I'm not sure if the video is going to play, but I'm going to try. This is the 1999 movie, The Matrix, and Neo, the main character, is about to be jacked in to learn a lot of different things. And so you can see the process here. There's cartridges that have knowledge on them. Those could be WHO guidelines, yes, plugs into his brain, and you're going to see, he's going to learn very quickly. So the question is, when we talk about digital learning, what are we imagining or envisioning? It looks kind of painful, and it doesn't look like much fun. So that's, yes. So that's, ask yourself, when you think about digital learning, what is it? And how is it different for those of you who've experienced Scholar courses from what you're experienced there? Now, digital learning can't be like that. Not solely because technology isn't there yet, but because that kind of learning, which is about transmission of information into our brain so that we're able to recall it, isn't necessarily what we need. I'm going to explain what I mean. So for example, this is an instrument of war, but it turns out that it can also be described in more abstract terms as a high reliability, self-designing organization. What does that mean? So this is from a famous study from 1998. The folks who wrote it were actually trying to figure out how to justify continued financing of aircraft carriers in the United States. But outside of their purpose, what they showed is that actually there is no instruction manual for an aircraft carrier. Why? Because there's so many things going on. It's simply too complex to describe. And there's extreme job rotation. Every, I believe it's 12 to 18 months, people who work on these ships move to a completely new job. So think about immunization and think about how complex is it. It used to be simple. a simple intervention. You still needed to know how to do it. And now there are new vaccines, and now there's all kinds of complexity. So the reassuring thing is that with new approaches to learning, with new approaches to doing, and new approaches to lead, you can actually figure out how to manage complexity in extremely complicated work environments, in situations of conflict. And I believe, in fact, that many of you are doing that learning, just it's not being recognized because we're stuck with this container view of knowledge where we think of knowledge as a reservoir, when it's more and more like a fast-flowing river. Think about your inbox. It starts with your email inbox. When we think about knowledge as a product, something you put into a box, that's what all these databases are about, when actually it's a process. And then there's this really interesting data point. This is from a longitudinal study by Robert Kelly at Carnegie Mellon, who's been looking at, for knowledge workers, how much of what they need to know is stored in their brains. So in 1986, that was 75%. And by 2006, that was down to 10%. That means that even pre-COVID, whatever you needed to know to do your job, and I would qualify many folks working in immunization as knowledge workers, you had to connect with others, or increasingly you have to connect with machines. So that is really some of the parameters that we need to think about. And then came the shock of the pandemic. So I'm going to share, we call them 4 secrets. That's kind of for marketing purposes, but really it was about trying to understand, well, many people just tried to do everything that they used to do. So they had a 3-day training, and instead of doing 3 days face-to-face, because they couldn't under confinement measures or other restrictions and freedom of movement, they realized they could do it on Zoom. And that's already a step forward. But it kind of goes back to this image of what learning looks like. I'm going to share 4 secrets, if you will, based on, in part, our experience, of course, but also a survey we did I believe in May 2020, asking a number of international organizations, what's been the impact of the shock on your work, on your business? And so this is, we said basically, this is how people described their situation in May 2020. The first one I think is the most eloquent, but you can see the others as well. So, and then we had, for example, an international organization that's working that provides guidance to partners that deal with mines and other explosive ordnance risk. And workshops and events in affected countries were canceled, but then they realized they could still provide remote support. Another organization that we work with that works in refugee camps, and they said, well, our activities include these things, and all these activities have to stop for the protection of our frontliners, the children and parents. This is May 2020, so it's receding into the past, but it's still our daily reality in many countries where there's still restrictions on freedom of movement. Here's another example, and really a lot of testimonials, from people doing internet work inside organizations. That was quite dramatic. So there's a key question that we asked back in May 2020, and we now know it looks like it's for the long term. How long will the shock last? We saw this interesting, we began to receive, we were inundated, flooded with requests. People knew that we were running courses that were fully digital, running completely remote programs, and have been doing that for years. So we started to get requests like this. So this person wanted to know, I need someone to help for a webinar. Which is the best platform? What are the links, the instructions? How do I monitor the events? I need help launching polls and all that. And that's actually the first secret, is that it's not about the tools. So of course you do need some, you do need to figure out and make decisions about which tools to use. But the secret is that they're all terrible. All right. Even Zoom, which we've all grown used to, is actually, it doesn't, if you think about the experience that we enjoy sitting in the room with people from all over the world, sitting in the room with colleagues that we know and trust, having coffee with them. Zoom doesn't do that for you. None of the platforms do that for you. And so if you focus too much on the tools, you can only get frustrated. So if you're thinking about what to do, like how, which tools to select, it's not about that. At least that's not the first consideration you should think about. Second example is in February, so this was quite early on. We received this this invitation, and I was due to go to attend this meeting in Paris. And actually, what I thought was quite bold was they then said the forum will go ahead in a virtual format, allowing participants to join the sessions from anywhere in the world. And I was excited by this. I thought, wow, this team really has it together. Even in the middle of the pandemic, they're still quickly pivoting and doing exactly what I was recommending that organizations do rather than cancel or postpone their events. But it turned out not to be so easy, and saying we will hold the event online turned into we will hold a series of webinars throughout the year. And we'll be providing additional information on the upcoming webinars in due course. So that's, yeah, that showed really that most organizations that have been doing primarily face-to-face, including those working in the field of immunization, what they needed when it came time, when they had to make the hard decisions about pivoting or postponing events or canceling them, is that they probably realized that they needed capabilities that they had not invested in. And these capabilities to run digital events, to do things, to work remotely, all of those things, the tools, solutions, providers, exist, but most people who were invested in that face-to-face workshop and training culture were not connected to them. And then when we asked people who came to what we call the digital conference event, where we really try to engage with people from international organizations, they said, well, exchange between human beings is naturally face-to-face. Like, that's just the way it is, and there's something natural, so cannot immutable, and dialogue and idea sharing is always harder virtually. Meeting face-to-face has taken my working relationships to a high level. In my view, this cannot be recreated in digital space. This is what people told us when we asked them, why, what are the barriers to you moving your activities to the digital spaces? And this is secret number 3. It's not going to work until you question assumptions such as these. If you underestimate how big a change process this is, especially under the shock of the pandemic, when really, not only did, it's not like an organization that says, okay, maybe we should move to digital and we'll take our time to do it. This was overnight. In many countries, confinement measures made it impossible to do business as usual. And so the thing about questioning your own assumptions is that skepticism about the value of anything other than pure thought is actually, you can trace that back to Plato. And so when you think about why it's hard for people to adapt to working in the digital space, learning in the digital space, so working remotely, doing remote supervision when it comes to immunization, or trying to deliver training online, there's some deep-seated cultural cultural resistance that goes back all the way to the to the classics. Now, if any of you have children and live in a country where Snapchat is in use, this is Nathan Jurgensen. He is the resident philosopher at Snapchat. And in 2012, there's also this view, that there is a kind of dichotomy between online and offline. And people say, yeah, I'm so happy, I'm going away, I'm not going to look at my phone, I'm not going to be checking my emails. And people also often say, well, this is a virtual training, as if it was not real. And Nathan made the point that Facebook is real life. Facebook doesn't curtail the offline, but depends on it. And that's extremely relevant when we think about how we move a training or how we move supervision to a digital space. We need to stop thinking that somehow virtual also, if you look up the dictionary definition, means less than real. And that's not what it is. Now, we also asked in this survey, what do you believe is the most difficult aspect of a physical world conference to recreate in a digital space? And this is where people told us that is first, the hardest thing to recreate is partnership dialogue and negotiation. Second is high quality public dialogue. Third is participation free of work and life distractions. Fourth, chance encounters and meetings. And then 5, surprising to me that it's only number 5, informal socializing, which is extremely difficult to recreate. So I'm just keeping an eye on the chat, and I know Sushi Kapoor and Pervez Yousaf, who are contributing to this session with their moderation and rapporteuring, are as well. So we are at the 20-minute mark, and this is where, from this research that we did during this period, we had to do something. We kept getting flooded with individual requests. So we actually built a program called Digital Conference, where we worked with a number of international organizations to help them transform their events. And this is where we developed a framework around structure and culture. So really two components of that sort of identify, and the idea was things to think about. There is no recipe for how you move online, how you pivot your trainings or your activities online, but you do have to think about these two things, structure and culture. What does culture mean? So we're talking about co-creation, diversity, digital literacy, lack of informal spaces, social space, nonverbal language, habit. And for structure, looking at connectivity, time zones, major issue in the Further Teach to Reach conference that we had to keep in mind, tool selection, languages, information security, attention, the risk of failure, and the difficulty that around these structural issues. So again, we looked at what people who were organizing conferences, who were trying to pivot training, told us in through our research. For an international conference, the whole meeting needs to be broken down into smaller segments. So we saw the diagnosis of a problem, but we also saw many people, realizing that there were solutions. Connectivity was the other problem. How to select tools. There are probably some good tools out there, but it's difficult to select one. Language interpretation. We have not been able to crack the various functions required for interpretation. Information security. How, especially for international organizations doing politically, diplomatically sensitive work, how to preserve that, when you don't have a private meeting room, a physical space that you can more easily secure. Attention, it's difficult not to get distracted. It's difficult to keep the audience engaged. The risk of failure and the difficulty of it all. So that's what we have on the structure side. On the culture side is, and again, these are elements of the framework to think about and to consider. So if you're considering pivoting, if you have, but you want to review, you did it quickly, and you now want to go back and review what you did and try to evaluate, figure out how you could improve going forward. If you decide to keep doing it by digital means, these are some things to consider. So for the culture, the co-creation, diversity, and so on. So let's look at co-creation first. And this is a difficult one. I'm not sure how to recreate interactive group activities online. What I have seen so far, mostly webinar type, where one person does a lecture. Diversity, how do you make sure everyone understands and is having good conditions to contribute in the exchange? Digital literacy, how do you do it if people can't figure out how to log in, can't figure out how to get to wherever they need to go, whether it's a training, a conference, a workshop, whatever it may be. And then the lack of informal spaces. How do you recreate, the coffee break in a physical conference? How do you recreate those informal spaces where you chat with people, you get to know them, and that you build relationships as well? The social space is very much a part of that. The nonverbal language, can you tell what people are thinking and feeling if all you see is that there are 400 attendees and at best you see their names and maybe a profile photo? How can you tell apart from that? And then habit, because we're so used to having these types of interaction in person, I think that's actually one of the keys. So to recap, this actually gets us to secret number 4. And really, if you take your event, so whether it's a training, a workshop, a conference, whatever it may be, you can actually reverse engineer it. And this is what we developed. Building on this framework, we then build a semi-structured methodology and path through which an organization or an individual trainer could actually take something that they're doing, whether they moved it online sort of in the shock of COVID because they had to, or whether it's still face-to-face and they just haven't been able to pursue it. And using these components of the framework, looking at each one, thinking about examining the context, we can actually unpack both the structure and the culture, and then select the right tools, the right partners, pilot, implement, and scale. We actually helped a number of organizations do that in a 4-week program. So also at the time, speed was of the essence, and we've now integrated that to be able to do this kind of transformation and pivot very quickly and hopefully very efficiently. So to recap, it's not about the tools. It's not about whether you use Zoom or Teams. It's really about something else. So don't focus on the tools you pick. They're all bad and none of them work properly, and we have to make do with them. Secret number 2 is that probably, unless you are digital learning, focused on digital learning, you probably are going to need to learn to do new things, new capabilities. Secret number 3, it's not going to work until you question your own assumptions. And again, those assumptions, don't underestimate how they may be deeply culturally rooted, as well as rooted in an economy. So we discussed in the Francophone session for Teach to Reach this morning, we discussed the question of per diem. The excuse for giving people per diem in immunization training is often that people have to travel and they need to, of course, they need to eat and they need accommodation. But with digital training, if you no longer need to cover those costs, what happens to people for whom per diem is actually, actually helps them, put bread on the table? So that's a real question in the immunization context in some countries. And then secret number 4, you can actually reverse engineer your event. So when you, as I said, when you look at each component of the framework, unpack it, and then you will have a sounder basis for piloting, implementing, and scaling. So that's so all of this framework has now been put into the Digital Scholar program. And so this is a comprehensive program that takes working professionals, so not learning specialists, but people who are, trying to get their business done and achieve their business objectives or their immunization goals, or to improve vaccination coverage, and really will take you through this whole process, not only with respect to pivoting, but through the design, how do we develop learning to drive change, analysis, facilitation, financing, leading change, platforms, apprenticeship, and partnership. So that's it for my presentation. Eagerly looking forward to the questions. And let me just stop sharing my screen here. Yes.
Yeah. So thanks, Reda.
Very much looking forward to see if there are questions.
Yes. So thanks, Reda, for the insightful
comments.
Yeah.
Happy
thanks.
to answer them. And Sushi, I'm sorry.
Yeah. I was just saying thanks, Reda, for this insightful information about digital learning. It's like, I think so. It's good. We all have to equip ourselves with all the complexity and the other things that you said, like with the kind of new working thing that everything is like moving us, not because of the pandemic, but moving us to move from the face-to-face more into learning platform, like digital learning. And yes, 4 secrets were like, I think so everybody should keep in their mind. So they were like, before that, there were like 2-3 things that there was a question by, like, there was a comment by Pravesh. He said, like, only motivated persons can learn from virtual training. And he also said that at frontline workers seems to learn more in the face-to-face training. Do you want to comment on this? Like, maybe I just like your comment on this.
Yes, sure. That's a very good question. So actually, that perception is not borne by the evidence. So it's a common perception, and I think in most cases, it's actually due to when you are face to face in the classroom with somebody as the trainer. It is incredibly, you get a lot of information. So if someone is asleep, yes, you can tell that they're sleeping in the training. So you know that you need to adjust your delivery. With digital training, and so with motivation, we know the recipes for motivating trainees in the classroom. And so I would say that it's more the lack of familiarity with what works in the digital space. It is very different. Learning to read the signals that people send. You get, at best, you get some emails where people say kind of strange things, and you have to learn to decode that. So a lot of what we do at the Geneva Learning Foundation and programs we run, we actually have these meetings where we talk about what we review, what are learners telling us. And it's a completely different capability than the one that a good face-to-face trainer will is likely to have. So it's about relearning how we read the room, but the room is definitely there. The dynamics are definitely there, and if you get it right, I would claim that you actually get much more information through digital means than you can in the classroom. But it's really that's the reframing that we need to do. And again, in terms of what the evidence says that yes, leveling for all other differences. So of course, if you have a bad online program, it's not going to give you outcomes as good as a good face-to-face training. But leveling for all these differences, the two meta-analyses that I shared, they show pretty definitively that people actually get better learning outcomes online.
Yeah, thanks, Reda. There was also we are getting questions. Like there was a question from Simon. He said, "What has been some of your challenges in organizing digital programs?"
I think the one around motivation is key, and I think is a one that many get stuck on. So let me think how. Yeah, so we keep a kind of running inventory of the challenges. So the motivation, I think, cracking that. So what we'll do is we'll look at a particular community of practitioners, of professionals, and really ask this question: what is going to get this group of people excited about about learning? And for that, we need to look at the culture side of things. So we need to understand what is the culture. So in immunization, you look at what gets people, and then you need to accept it's not going to be everybody. We do this very open access stuff. Anybody can apply. And that alone is exciting because usually training is you have a limited number of seats. You want to reserve it for the best people. And sometimes the people who are appointed to attend the training, they're not the best people. They're only the best people who politically who manage to secure the seats, to be given the seats to attend the training, or the most important ones, or the most, so that those are the kinds of challenges we face. But I would say that if you look closely at if you pay attention and you listen to the groups that you're trying to address, you can actually crack that motivation. And then, of course, with digital, rather than training 20 people at a time, you can train 200 or 2,000. And that scale is something we absolutely need. It may have been a nice to have in the past, but it's no longer that. I think it's something just to be able to tackle the challenges of our times for immunization, but also many other complex challenges we absolutely need.
Okay, thank you. There was Obid actually shared one of her experience that she actually applied to a course in TGLF, and then she actually faced a connectivity issue initially to connect with the Zoom, and then she said it's not about it's all about determination and doing things differently from a normal, which actually produce a new results in the coming year. Thanks Obid for sharing it. And there was also one thing which Abdul Mahid said, that diversity. Here, the trainer needs to be calling names randomly to ask direct question or ask their understanding on what was just said. That is to keep the audience engaged and not to allow distraction. Also, reward or acknowledge positive answers or contribution. So, he had actually commented on, there's no question to the speaker, to you. I think so. There were a lot of thank you. And then there was a question from Ezibola. How do we apply successful digital learning to remote settings?
Yeah, so, all right. So first of all, on Abdul Hamid, what I hear in his comment about diversity is that he is likely to be a very experienced face-to-face trainer, and maybe also a digital one. So knowing the techniques, as if working in the classroom, you learn techniques, you learn ways and methods. You either pick them up or you do formal education to pick them up. And because digital learning is newer than face-to-face training, there isn't as much that is established about how you do things. But I would say that that's also what makes it really exciting. So what makes it really exciting is that the rate of change is keeps accelerating for digital learning. So if you think about what you can do in face-to-face training, it's been around for a long time. Obviously, it's in a way being sharing physical space as part of our human existence from the time we're born, and it's not changing very much. You know, you can try rearranging the tables in the room or the chairs. You can do various things, but whereas with digital, I think this is really the early days. It's like steam engine days, and we haven't even figured out electricity yet. So if you think in those terms, yes, it's a terrible experience. I would much rather be with you, Sushi, and Pervez inside, sharing sharing time as human beings together in a shared physical space. But how that is changing very fast, and that's what makes it very exciting.
Okay, so there was also a question from Ezibula. How do we apply successful digital learning to remote settings?
Right. So remote settings. Okay. So let's be honest. If you don't have connectivity, the solutions that exist are being neglected. Why? Because the rate of change, again, is so you have in the capital city pretty much anywhere in the world you can get decent connectivity if you can afford it, and then there's a frontier. As you go farther out from the capital city, you get to the place where you no longer have any connectivity, right? Where that place is, that frontier, that border keeps receding, and that's a good thing. But that means that in the past, there were people who developed all kinds of creative solutions. So like, I remember seeing like a little box. It was like a little wooden box that you could build yourself. And inside it, you put basically a microprocessor and a little Wi-Fi chip, and you could set up a server for a remote village. And it had its own electricity, solar-powered electricity generator. And that was how you gave connectivity. And then health workers could access trainings. Those kinds of solutions, I think, are being neglected. This is basically the big technology firms, so Google, Facebook, and so on. They need to keep to really, and actually, in a way, so there's positive aspects to this. They want to get everyone as a customer on their platforms, and they're willing to extend the access, in order to do that. But that means it's increasingly difficult to think about how we reach. We talk about SMS-based solutions. We heard folks from Gavi talking about that yesterday. We're focused on, we'll go as far as that frontier is, and we'll push to make that frontier recede. We've seen people in our courses go from 3% were from health facilities just 3 years ago, and we're now at somewhere between 20 and 30% of people from health facilities who are able to connect, some with great difficulty, some with a personal sacrifice related to the costs, but things are changing very fast.
Okay, so there is also we are getting a lot of so there's also a question from Pravesh. He said digital training works at national and provincial level. What about most important training of FLW, like frontline workers? We have a lot of feedbacks and training monitoring from different levels staff, even third-party staff, even FLW wants to be trained face-to-face training.
Yeah. So change is hard, and so you have the reality of connectivity, but I've seen situations in which the diagnosis starts by saying they do not want digital training, and then we look at it and we see that actually it's a group that may not have a lot of resources, but they're actually using their phones all the time to connect. It might be SMS messages if nothing else is available, whatever and so we first look at, are people using these digital technologies in their daily life? If they do, if they are able to do that for themselves, whether it's using that to make payments, using their phones, connecting with their relatives and friends, then it's a motivation problem, not a technology problem. So I would say first look at that. Which is it? It could be both. That's another issue. But and then if people are actually using these technologies, but they're reluctant to use them for training, then it becomes a motivation issue. And then you need to figure out what strategies will help you get over that motivation gap. But I would be suspicious of people saying, so about the reluctance, people saying they prefer face-to-face training. Of course they do. Who wouldn't? Yes. As I said, I would rather be in the room with you, but change is going to happen, like it or not. Increasingly, international donors are reluctant to fund face-to-face training. So why not, if you're an immunization, you organize, you have some responsibility for these trainings, why not be smart, get ahead of the game, and make sure that it's you who owns that training that is going to be offered, because you know the frontline workers that you have trained in the past. And so without your expertise, that digital training from above is likely to be poor quality, ineffective, and to be then really rejected. So you can be the change agent that helps those who are developing that digital training figure out how to do it so that it is adapted to the context, and so that there is support and recognition of people's willingness to change, from a conventional model to something new.
Yeah, so there was actually a comment from Gift. He said the face-to-face training gives immediate feedback. And there is also one question from Ilya. Like, he actually asked, like, I think so we've already addressed it. Developing and underdeveloped countries need detailed training, but network connectivity and electricity have a negative impact on online training. What are the possible things that you can be done to reduce this impact? Like, if you want to say something, I think so it was already addressed, but you want to add something.
Yeah, I can add that, I think that problem is being neglected because of the drive to extend that connectivity. So that's what I said before. I think no one has mentioned literacy, but you cannot use the internet, or it's extremely difficult to use the internet if you do not know how to read and write. And we know in some countries, some of the folks involved in immunization are not going to have a lot of formal education. And I mean, that's where you get to the sort of systemic roots of the and how things are interrelated. So that's why we can and should be suspicious of solutions that consist of, say, dropping videos from the sky, in the same way that in humanitarian interventions you might drop bags of rice and saying, well, let's throw these videos from the sky and hope that someone will see them, view them, and use them and apply them to develop their competencies. So dubious about those models, again, it requires respecting the people on the receiving end. So I think right now there's a situation where people, say in Geneva or Seattle, get very excited about digital training and say, well, let's give them digital training, but without really going through the analysis of the structure and cultural elements involved. And so the risk is that face-to-face training stops. And so the benefits of face-to-face training, because, for example, if you're working in a country, you want to get to international, you want to do international level work, those workshops and trainings are a key site where you can meet people from Gavi, from WHO, from other organizations, and it's in the coffee breaks that you build the relationships. If you take that away and you replace it with e-learning, where you're sitting alone in front of your computer screen, looking at videos and taking a quiz at the end, you're losing something very important. So if you want, so a lot of these changes are about, sure, there is the lure of efficacy and scale, or at least scale, you're reaching a lot of people, but that is only one part of the problem. So we need to be wary of those too easy solutions that don't consider, the change process that's involved. We cannot stop doing things that were critical to people's professional development and offer something that is inferior in the name of professional development. Our duty, moral obligation as educators is to think through how are we going to support and and people through that change process. So face-to-face trainers who have all this experience, delivering training in difficult contexts, going to those remote areas, the risk is that we forget about them, we discard them, we say, well, you're no longer needed, we're replacing you with a machine. That is a very scary prospect, and that is something that we need to fight against. As we advocate for change, we cannot allow the collective experience of trainers, of people who in immunization who know what gets the job done, and sort of throw that out, even as we move to improve trainings.
Yeah, so there are a lot of comments, and then because of short of time, there's a question from Adrina which is addressed. Can you discuss the trade-off in scaling digital training, like effectiveness having 2,000 people in a Zoom? Like, that's what she said an example. Do you want to address this? And there's also a question from Eric. He said, how can you influence people you invited to participate in digital learning?
So
And
yeah.
And then there's also a question from Simon: what are ways to sustain interest in digital learning? Like, this is actually very related to the above question. So that's yeah.
So first, a question of scale. So yeah. So as you scale, you lose. So if you think about what is the relationship between the teacher and the learner? So some of the best conversations are singular. It's like one-on-one. It's like the time you spend with your professor, with your teacher. We know that tutoring is highly effective. Having one person sit down with you and say, show you and ask you questions and challenge you to go a little bit further until you get there, that is extremely powerful. And that right now, we don't have a really good way to scale that. Yes, what we're building. So for those of you familiar with the Scholar program, the scale has come from what we've done is rely on peer support and specifically peer review. So the formal aspects we do through rubric-based peer review, and then the other part of scale. We called on we weren't sure if it would work, but we sent a message to all of the participants in some of the first courses that we did, and we said, would you be willing to spend a little bit of time helping your colleagues who are starting the new course? And what surprised us above and beyond our expectations is just hundreds of alumni responded and said, yes, I want to help. I am ready to help. And so it wasn't about helping us. It was about helping colleagues, and that was a crucial difference. If we had said, we're looking for tutors, would you be willing? Yes, that's a different relationship. So I think what you lose with scale typically is obviously quality, is personalization, is and the space for going beyond information transmission. So there's this model in which you want to push out information to people, but who are they on the receiving end? What do they know? What do they care about? How can it be a two-way relationship? That's much more difficult to do at scale. On the question of how you influence people in digital learning and sustain interest in digital learning. So I'm not sure if you're talking about influencing sort of managers who make decisions. So you want to convince your manager that rather than doing a traditional face-to-face workshop, you should do something else using digital tools, and that can actually lead to better outcomes. So that's, first of all, it's difficult for the reasons like the sort of historical roots of why people are going to be skeptical about this change. Also because of habit, just like how for people with a university education or whatever that model, that industrial age model of education is still with us, is pretty resistant to change. And that makes it a significant challenge that should not be estimated. How you sustain interest? Well, it's sort of constant renewal and reinvention. So I don't think, like, what we're trying to do at the Geneva Learning Foundation is constantly think through, okay, what do we do next? We know that it's not just like copy and paste. It cannot be, you cannot simply repeat even something that worked tremendously well once. Unless you're thinking and listening, it may not work the second time, much less the third time. So when we look at new cohorts of the same course, then we don't just assume, okay, we'll just do everything the same way we did it. We first do that review of the culture and structure and figure out what has changed, what is changing, how can we do better as well. So it's very much about continuous quality improvement.
Yes, so basically a lot of questions related to connectivity issue, and then there was a question from Dr. Anthony. You already addressed, like, related to motivation. Face to face, you could keep the class for 5 to 6 hours, but with the digital learning, we have observed that our participants are not with us after 3 to 4 hours of interaction. And there was also comments from Dr. Taimur, who said that when we become a part of TGLF, it was something new. But later on, when things were enforced to do a virtual training and meeting, people had an issue. But we are doing it confidently thanks to TGLF. And then there were like comments, peer reviews and support from colleagues very useful in digital learning. So do you want to address? And then there was also some questions related to connectivity. So there was from Dr. Anthony. He said, in terms of cost in Nigeria for national level training during the lockdown, it is cost effective, but we have seen a lot of distraction and less concentration, internet issues, cost of good phone. Yeah. So do you want to just so there were a lot of comments about the digital learning, and they're sharing their experience with the TGLF, and many people were thankful for it's actually helped us to digital learning.
Thank you, Suchi. Yeah, and we've seen, I mean, we're really proud of that. We consider that in the TGLF programs, we develop digital skills, so
Yes.
digital capabilities, and you have to in order to take the course. So the story I love, or one story I love, is this professional from WHO, very highly qualified and experienced, of a certain age, from Madagascar, who's working in Central African Republic. And she sent me a message, or I think we actually chatted about it, and she said, well, I had never used the social media, not even WhatsApp or Facebook. And after taking our course, she actually went and created, so she's a grandmother with an extended family all over in several African countries. They don't see each other very often. And they actually created she created the WhatsApp group for the entire extended family. And for the first time, everyone was connected to everyone else, and nobody expected her to do it. I think, to me, that's one of the most successful outcomes of a course. It has nothing to do with immunization, but everything to do with that digital literacy. The second thing, obviously, are the technical skills. We know that what matters at the end of the day is your ability to do your job. So, of course, when we work with WHO to build a course around the global routine immunization strategies and practices, we know that is, that technical knowledge is important to getting the job done. And then the third thing we try to develop is the leadership. And you cannot tell someone, be a leader. And I know there are different models of adaptive leadership. There are different kinds of sort of leadership models, but whichever one you fancy, it's clear that ability to see yourself as empowered, that you can do something about your situation, is extremely important in relation to motivation. And we saw that in 2016, for the very first pilot course that we did with WHO, I saw a message suddenly pop up. Somebody said, we're meeting in Nairobi for breakfast. I said, what's going on? Why are they meeting in Nairobi for breakfast? And it turned out that people from several countries were driving in. The learners, participants in this course, were driving in to see each other and to meet and to discuss the course. When I saw that, I said, okay, we're onto something special. And then we began to hear more and more narratives of people. For example, one learner, a woman working in a remote area, who would drive 400 kilometers every weekend in order to connect, to get to a place where she could have connectivity. And so that equation of how we get that, that motivation, you cannot tell somebody, please be motivated, all right? And happy to take this course. And figuring that out is probably the hardest part of what we do. But if you can figure that out in your context, there's, then everything else, it doesn't, like even the connectivity problems, the same people who will say, I don't really like to connect on the internet and I don't see it, I don't like this kind of learning. If they see something that is going to benefit them, where they can see how this helps them, they will suddenly solve the problem of connectivity. Yes, and there are some issues around affordability and so on. So again, it's complicated, but that's what I will say. Also conscious that we have at best 3 minutes left in the session.
Yes.
Thank you so much.
Yeah, so that's I think so. There were a lot of questions, but then obviously because of the limited time, like there were a lot of questions related to how to keep them engaged, how to make them attentive, how to make them more engaged and motivated in the virtual. And then people were also saying that face to face is more you get the comments, and then you have more, you can motivate people because they are face to face. And then obviously TGLF has actually helped. There was also saying that pandemic also forced people to move to virtual platforms. But I think so we are not have time to address some of the comments. So but thank you participants for all the comments. And then I think so you can actually reach out to, if Reda is you can actually reach out to him for any queries related to virtual. And also he shared there was a digital score, I think so digital you already shared that there is also a digital scholar programs, right? Do you want to say something about that so that people can actually be part of that program and learn how to get this skills?
So we're working on this, and this one of the, perhaps we'll make an announcement tomorrow in the final plenary, but that's very much part of what we want to do, building on Teach to Reach, is really offer this comprehensive program so that people working in immunization can come in and really focus on their issues. One of the reasons I can't give you recipes for motivation is because it is context specific, and you know more about your people, the people you work with every day, than I do. So it's through the collaboration and the collaborative exploration of possible solutions, unpacking that structure and culture, that we can actually help you problem solve, and that's definitely what we intend to do in this program. So thank you very much for the wonderful moderation, and to Pervez Yousaf, and to all of you for the great comments and questions. Of course, we already know each other from many people in the room, but I'm hoping also that there are some folks who are not scholars, are also here, and look forward to welcoming you in a future course on behalf of the Geneva Learning Foundation. Thank you so much.